For our offices in San Diego, there really is sort of a tetrarch of Medicare health plans that folks primarily ask for. They are those most well-known and generally the largest carriers, meaning it's either Blue Shield, Humana, Aetna, or United Healthcare. So today, we are going to focus on a plan review of a sort of unique emerging style of Medicare plan. It is not an HMO, and it's not a PPO, but it is an HMO point of service plan that is the AARP Medicare Advantage offered by United Healthcare. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know has questions about their Medicare health plan options, either right now or really all year round, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them in person or over the phone at one of our many Southern California offices in English or Espanol. Also, don't forget to like and subscribe. So the AARP Medicare Advantage plan from UHC has really a lot of interesting things about it overall. First is the UHC and the AARP relationship that is often one of the first things that catches a client's eye, because yes, AARP is such a trusted entity for retired Americans, and because UHC is very well known, to say the least, and has been around for a long time. Initially, the plan design is a unique design because it is that point of service HMO plan, meaning that it has the option to go to in-network doctors and have set copays and set costs and set deductibles like a normal HMO, but it also has the option to go see non-network doctors at a higher cost, but it's not so restrictive as the standard HMO plan. There are some extra rules about which doctors can be seen out of network and higher costs, which we'll look at, but still, it's an interesting approach to a Medicare Advantage rather than the same old HMO and PPO dichotomy. So let's start off with the big numbers first, and that is going to be the monthly premium and the maximum out-of-pocket that a beneficiary can pay on the AARP Medicare Advantage plan from United Healthcare. And it's easy enough. Right off the bat, there is not going to be a monthly premium for the plan, meaning that if somebody enrolls in this plan, well, obviously there won't be any monthly payments. And although that is true, it's not really the whole story, because in order to be enrolled in this plan, somebody must keep both their Medicare Part A, that's the hospital coverage, as well as their Medicare Part B, that's the medical coverage. Now, that's not such a big deal with Medicare Part A because there usually is not a cost for the Part A for most folks. But the Part B does have a monthly cost that in 2025 is $185 a month. And that will usually go up every single year. Ultimately, you have to keep that Part B though, that $185 a month, to be able to still stay enrolled in the United Healthcare plan. So there's no monthly cost for the United Healthcare plan, but you still got to keep Part B, which is $185. Now, for the maximum out-of-pocket, this will be really where we see two different costs that are applicable depending if someone is using an in-network contracted doctor or going to go more freelance and finding non-network doctors and using the point of service functionality. Because we can see here that the maximum out-of-pocket, or the MOOP, for in-network providers is $2,900 per year. This is the most money that a beneficiary could pay in the year for medical usages, so doctor's visits, specialist visits, x-rays, etc. But if someone decides they want to use doctors who are not directly contracted with United Healthcare, but they are able to take Medicare payments, well, that client can still go see those providers under this plan, but the maximum out-of-pocket really ends up going up a lot, like a lot. In fact, it goes up to $10,000, which is basically 3 times as much. Realistically, when we look at that, it is nice to have that option to go out of network, but the costs are going to end up being very prohibitive to a lot of beneficiaries. Even that said, at $2,900 for the in-network providers for the maximum out-of-pocket, I mean, that is on the medium well side of MOOPs in San Diego in 2025. Anyway, so it's already sort of high, and then going out of network, just gonna make those costs go even higher. Next up, let's take a look at the doctor's emergency care and prescription coverage, because this is another zone where we will see sort of a stark difference in cost based on the decision to go to in-network or out-of-network providers. So looking at the doctor's visits, we can see that for in-network doctors, the specialists are a set price at a copay of $0. But when we slide over to that out-network, we can see that 1, primary care visits or primary care doctors are not going to be covered for the out-of-network option, but the specialist will be covered, but the copay jumps to $30. So not a ton, but still definitely a noticeable jump. Emergency care, so that would be going to the emergency room or even getting admitted to the hospital as an emergency, but that is going to be a copay set at $120. Now, emergency care is one of those situations where either out-of-network or in-network divide doesn't have much effect because of the case it is an emergency. So someone would always be considered in-network when they are in an emergency, because the rationale is that if you are having an emergency situation, you can't tell the helicopter which hospital to land in, or to be like, only land inside the in-network hospital. So they will usually just take you to whichever one is closest because it's an emergency. Lastly, let's take a look at the prescription drug coverage. And with prescription drugs, the drug costs are not the whole story because of the types of medications and the way each of them are tiered, like which level they're going to be at, is going to have a big impact on the plan that fits a person's needs best. So it really will depend on a specific person's prescriptions, but in general, when we look at the drug coverage that is automatically included on the United Healthcare plan, it's important to notice that there is a deductible, which is the initial amount of money that a beneficiary must pay at 100% out of their own pocket before the plan starts to help pay for those costs. That deductible is only applicable to tier 3, 4, and 5 medications, the expensive ones, and the deductible is $255 a year. But for the more common generic medications at tier 1 and tier 2, there is no deductible, meaning that copays are $0. So yeah, this is going to come down to which prescription medications that somebody is taking and what tier they happen to be on, which could be a major part of the decision making for this section of the plan. That being said, in 2025, there is going to be a $2,000 yearly limit on the total cost of medications that a Medicare beneficiary can have because of some legislation that just came into act in 2025. So overall, it's a good stop loss, but $2,000, albeit still a lot. So looking at the AARP Medicare Advantage plans offered by United Healthcare, we can see that this sort of eccentric plan design is basically still an HMO, but with some allowances to go see out-of-network providers in some cases at a pretty elevated cost. And realistically, in most cases, someone would be very selective about those out-of-network providers anyways, and use them only when in-network providers would not suffice, which is, still a big selling point, but very important to understand. But either way, if you or somebody you know is looking at this or really any of the Medicare healthcare options, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.